saying.
Say more. No, I'm just kidding. All right. Preschool. This is a great age. So after you get out of the toddler age, which is like, don't make eye contact, don't look at them. Like, you'll know, like for toddlers, when you go into the room, like you do not look at them at all, except they do not exist. You talk to the parent only. Once the toddler sees like, oh, my mom's not like scratching this person's eyes out, like she's probably safe. Even then, I don't make eye contact. I try to stay as far away from the child as possible. Okay. All right. Preschoolers though love exams, and they love you, and they want to bond with you, and they want to hang out with you, and they want to play with you. And it's just the most goldenest age on the planet. Okay. All right. So big keywords for preschool: magical thinking and pretend play. Everything is a game, and they think in their mind, even though they're still very egocentric, they definitely can see the world around them, but they think they are all like superheroes. They're invincible. They can control everything with their mind and their thinking. Okay. So like, if I think hard enough about something, I can make it happen because I am invincible. Right. So their Erikson stage is initiative versus guilt. What does that mean?
Like they'll try something and they'll just do whatever, and then if like someone tells them like no, or if they do something wrong,
like they feel like it's their fault. Yes, they're going to put it all on themselves. Okay. But they want to show their own initiative and to do things. Okay. So we need to let them do that and control what we can allow them to control. Like, because remember, their whole life has been controlled. Like, I'm going to tell you when to pee and when to poop and what to do and when to eat and when to go to daycare and when I'm going to pick you up. So at this point, they need some control over things. So they're going to show some initiative. I'm going to do this and show my mom, I did this. But they also take on a lot because they think their mind controls the entire universe, right? So let's say you and I are friends and we're 4, okay? And we have a fight. And I, in my mind, think I hate her. I hope she falls down. I'm never going to be friends with her ever again. And then the next day my mom comes in and she's like, oh my God, Andrea took a really bad fall and she hurt her leg. What am I going to think?
It was your fault.
I did it. Now, I may be happy about it. I don't know, but they may think it's something that they can control the world through their thoughts, but they may feel like really bad about something too. Like, let's say their mom passes away or something, right? And they think one time I said I hated my mom, it's my fault. So you have to reassure them over and over again, like, that's not your fault. That's not your fault, because they take on a lot. Okay. All right. Piaget's, we are in pre-operational, which I already talked to you about before, right? Yes. And pre-conventional, we talked about before too. Yes. Okay. Gross motor. So at 3, they can get on a tricycle. Okay. Stand on one foot. At 4, they get a little bit better in dexterity. So they can skip, they can hop on one foot, they can catch a ball, and they'll go up and down stairs with alternating feet. Remember, at 2, they can get upstairs, but usually they're like step together. Yeah. And then at 5, they can skip on alternate feet, jump rope, skate, swim. So 5, they become very good at like balance, right? Because it takes a lot of balance to do skating and swimming and things. You'll know preschool is 3 to 5, by the way. I didn't say that. Okay, just make sure. All right, fine motor, we understand 3, 4, and 5, right? And at 5, that's when they learn to tie their shoes, hopefully right before kindergarten. So that way the teacher doesn't have to tie 30 kid shoes. They can control everything through their thoughts, right? So like magicians and magic are like very big at this age because they think like, I can control everything, you know? All right. Bubbles are the absolute shit at this age. Like they love it. And we use it for distraction for everything. So you'll see Child Life will come in with bubbles during painful procedures and things like that, because everybody loves bubbles. I mean, who doesn't love bubbles, right? Distraction is usually the best way at this age because their imaginations are so big. So like when you're preparing them for something like hospitalization or procedure, do not give them a lot of time. Right? Because then what's their imagination going to create? If I know I'm going to get a shot in 2 days, I have 2 days to picture the biggest, most giant needle piercing me through my heart all the way through the other side. Like their imaginations are huge. So you do not give them hardly any preparation time. Okay. I would prepare them like right before we go into like the room to get a shot or something. Okay. Nutrition, 3 meals, 2 snacks. Now we need to go. Now it depends on how much the kid weighs. They can either be on whole milk if they're kind of like skinny. They could be on 2% milk if they're an average weight. That's typically what we'll put them on. They can switch over to 2 or 1 to 2%. They do need lots of calcium and vitamin D, and we are going to I don't mean like a low fat diet. I mean, when they were infants and toddlers, we had a massively high fat diet because they needed all that fat. Now we can slow down on that a little bit, which is why we go to the 1 to 2% milk. With me?
Yes.
Okay. 1,400 to 1,600 calories per day. They're almost like little grown-ups, you know, because they run. These kids love to run and jump and play. Like they are moving all the time. Make sure you do everything on the doll or stuffed animal first. This is what you're going to pick on every single exam. What do you do to prepare the kid? You're going to do it on the doll first. Okay. All right. So they are still in, we are in associative play and modeling. They will do exactly what you do. So if we see a kid is acting out in some kind of way, they learn that behavior from somewhere. It is probably at home. Okay. They like everything pretend, play, and magical thinking, right? So dress up, kitchen, house, school, Play-Doh, puzzles. I'm going to play trains. You want to play truck? Yeah.
Yes.
All right. It is very important for you to tell these kids the truth. If you lie to them, they will hate you forever. And what I mean by that is if you have a 3-year-old that says, like, let's say we're going to have to go start an IV and they say, does it hurt? What do you say?
Yes, it hurts, but it's very quick.
Okay, so you got to follow it up with something. Okay, so yes, it hurts, but I'm going to be there with you the whole time and mom's going to be there with you. And then afterwards you get to pick out a sticker. So that way we get some kind of reward. But if you tell them it doesn't hurt and it does, they will never forget, like you've broken the trust. So it's very important to tell the truth. Okay. Body integrity is vital. So you have to be very careful what you say because they're very literal because they're in pre-operational thoughts and their body integrity is important. So it does not matter if they fell down and they hit some, like they, hit, but there's no scrape, there's no scratch, there's no nothing. They still want a Band-Aid. Okay. Because they want to make sure their body stays intact. That's why it's hard for them to like poop on the potty because I have to watch that go. And you also have to be careful what you say. You cannot go in and say, okay, I'm here to take your blood. Where are you taking it? Okay. You can't come in and say, we're here to do a CAT scan. Who's cat? Like they think like it means a meow cat, right? I'm going to go, oh, I need to take your blood pressure. Where are you taking it? Like they are very literal and they want their body intact. So put Band-Aids on everything, whether there's something there or not. Okay.
And then what do you say for like
What?
blood draws?
I would say I need to get some germs from your body and see what's making you feel sick. Okay. They have an annihilation fear. So they are worried that their body will not stay completely intact. Do we understand?
Yes.
Okay. So if you're going to do like a blood pressure, I wouldn't even use the word blood. I would say we're going to give your arm a big hug and it's going to squeeze you really tight. I want you to stay still like a statue. Okay. So you have to find ways to make it fun for them and they will do anything that you ask if you make it fun. Right. So if you need to look in their mouth and they don't want to open their mouth. Oh my God, I thought I saw a rat in your mouth. Let me see. No, you didn't. Yes, I did. Let me see. Like you just have to make it a game and they will literally do anything for you. Okay. All right. 20/40 vision. We're still there. Yeah. Okay. Very, very, very literal. Okay. Be very careful with this. So on exams, make sure you don't pick something that can be misconstrued. Okay. All right. They can dress and feed themselves. They have a huge imagination. So we create our own imaginary friends. And now they start developing nighttime fears because in their mind, there's monsters under my, I've already thought of this whole scenario. One's hiding in my closet and as soon as the lights go out and my dad leaves and he's going to come out and he's going to bite me. And like, they've already thought of a whole thing. Okay. Now it is not enough to say that it doesn't exist because in their mind, it does exist, right? So you have to get really creative. So what would you do for monsters under the bed?
Look for the monsters.
Yeah, and get some monster spray and tell them like just put in like some lavender or something in a water bottle and be like, if you see any monsters, you spray them with the spray and they can't come back. And so they can go and like spray underneath their bed and they can spray on their bed. Like you have to find a way to meet them where they are. Okay. Okay. Tell time. This is huge. Okay. Before age 7, they cannot tell time on a clock. Okay. So before age 7 is not a preschooler, but time is a very big issue. So before age 7, you have to be able to tell time, like, you give them an event to look forward to. Okay. So if they say like, when is my mom coming back? And 2 more sleeps, she'll come back because they don't understand days. When they're in preschool, everything in the future is tomorrow and everything in the past is yesterday. Everything. So if something happened 2 years ago, they say, remember yesterday when we went to Easter? Okay. Or we're going to go tomorrow. Is tomorrow Christmas? Like they have no concept of time. Do you understand what I'm saying?
Yes.
Okay. So, it keeps telling me to breathe and I don't have time to breathe. Okay. Like I talk very fast. Anyhow, so you tell them like something to look forward to, or we can say like, when's mommy coming back? After lunch comes, or when it's dark outside. Because they still need to know and have an idea of when, but they just cannot tell time. Do you understand? Okay. We already talked about very little prep before procedures. Okay. Water safety is very important at this age because they think they are invincible. So if they don't know how to swim and they think they're invincible, they will jump in the pool. I mean, did this all the time. she has the confidence. I know she doesn't in here because she's nervous, but like anytime she goes and does something, it's like, oh, I'm just going to do it. So she would go and like run up to the pool, jump in, could not swim, sink all the way down to the bottom and just look at me like this from underneath the water. It would piss me off. I could not get her to like not jump in. So I just had to get swim lessons for her, right? Because she was going to do it, you know? So anytime you see water safety on an exam, you can always pick that no matter what the age group is, because everybody needs to know how to swim and everybody's going to come in contact with water in some kind of way. Do you understand?
Yeah.
All right. Big issues at this age. Obviously, child abuse is a big issue because preschoolers like to do their own thing and they're kind of obstinate and they're kind of annoying sometimes. And that is just a haven for people to hurt them. Neglect is common. Do y'all know the signs and symptoms of neglect?
If they like are dirty
Mhm.
all the time. If
So
they're
poor
wearing, like,
hygiene,
the same clothing. all
wearing the same
time.
clothes. If they're
Yeah.
stealing food from other kids is what we usually see because there's not food at home. If they're afraid to go home in the afternoon and they keep asking to stay. Why are you laughing?
Because the Dima's chair made a funny noise. Oh, sorry.
You're chewing?
Now her chair made a funny noise.
Oh, like it made a fart noise
Yes.
and you're laughing. So I was like, why are you laughing about child abuse, you sicko? Now I understand. All right, what is Munchausen's? Oh, I thought you were gonna say it.
No, I was something ramen. And I was thinking something munchy. Ramen? No, that's Maruchan. Okay.
Oh my God.
What is it in reference?
It's actually called Munchausen by proxy.
Sounds very familiar, but I can't. I've never heard of that.
You have.
Yeah, we have.
I feel like
She
I
said it
have.
before. I'm pretty sure.
Munchausen.
By proxy?
Munchausen by proxy.
Is it some sort of a disorder?
Yes, it's a
Uh,
parental disorder, not a child disorder.
When the
when the parent doesn't want anything. Oh, when the parent puts illnesses onto the kid.
Yes, when the parent
Gypsy Rose.
intentionally, yes,
Gypsy Rose.
Gypsy Rose, where the parent is intentionally making the child ill so that the parent gets,
Feels important.
it feels important or gets attention or what have you. And so they will have, the kid will have very vague complaints that nothing can be proven from, stomach aches, headaches, things like that. So that's something you have to watch out for. School fears are very important at this time because their whole imagination is like, and they may start going to preschool or to daycare, you know, nighttime fears we talked about, and then they start getting infectious diseases because they're going to daycare and school for the first time. So they're getting like hand, foot, and mouth and croup and like, you know, all these different things. All right. Do we understand the very, oh, sorry. Wait, did I say everything?
Yeah.
Yeah, I did. Oh no, identify with the same-sex parent still. We're still identifying with same-sex parent. Okay, that will change, but as of now, 3 to 5, they want same-sex parent. All right, do we understand and kind of have an idea of what preschoolers are like?
Yes.
Okay.
They actually came out with another movie about the Munchausen. They came
Which
out with
one?
another one. It's called